All right. Hello, everyone. We're going to get started. I know folks are still joining, but welcome to today's webinar, Philanthropy with an Equity Lens. My name is Danae Schmidt, and I am the Senior Manager of Engagement and Training here at the USBC, and I'm so glad that you've joined us for today's session. So this webinar has been made possible through funding from the Centers for Disease Control and Prevention. Neither the CDC nor any of its components operate, control, are responsible for, or necessarily endorse the content of this webinar. Live transcription will be turned on during the webinar today. As a reminder, the transcription is auto-generated and may contain errors. To turn it off, just go to Live Transcript in your Zoom doc and choose CC Live Transcript. Okay, during today's session, participants will be in a listen-only mode, but despite the virtual format of this session, we do hope that it will be as interactive as possible. So please share your insights and your questions throughout the session using the Q&A feature located in your Zoom doc. If you're having audio issues through your computer's microphone and speakers, we recommend trying to dial in for audio connection. If your challenges persist, please email office@usbreastfeeding.org, and one of our staff members will do their best to troubleshoot with you. As a reminder, this session is being recorded and will be accessible to all webinar registrants within 1 week of the live session. So today's webinar topic is philanthropy with an equity lens. Organizations, including those in the philanthropic sector, are really prioritizing the operationalization of diversity, equity, and inclusion to advance health equity. Leaders of private foundations and public charities are intentionally transforming their practices and culture to center communities as the driving force of social change, really rooted in trust-based values. We are so honored to have Dr. Cara James, President and CEO of Grantmakers in Health, join me in a conversation to share her expertise and insights on this important topic. Prior to joining Grantmakers in Health in 2020, she served as Director of the Office of Minority Health at the Centers for Medicare and Medicaid Services in the U.S. Department of Health and Human Services, where she provided leadership, vision, and direction to advance health equity. Under her guidance, CMS developed its first CMS equity plan to improve quality in Medicare, its first rural health strategy, created an ongoing initiative to help individuals understand their coverage and connect to care, increased the collection and reporting of demographic data, and developed numerous tools and resources to advance health equity. Before joining CMS, Dr. James served as Director of the Disparities Policy Project and Director of the Barbara Jordan Health Policy Scholars Program at the Kaiser Family Foundation. Dr. James holds a doctorate in health policy and a bachelor's degree in psychology from Harvard University. She's also a member of the National Advisory Committee on Rural Health and Human Services. She serves on the board of the Association of American Medical Colleges, District of Columbia Hospital Association, and Healthcare Cost Institute. I just have to say we have an expert in our midst. So welcome, Dr. James.
Thank you so much for having me. I really appreciate the invitation to join you all today.
Yeah, it's so great to have you here with us. You really wanted to spend a large portion of our time together answering the questions of our audience. So we're going to have a brief conversation, the two of us first, and then we're going to invite the audience into the conversation. So I'm just going to stop sharing my screen so we get to see your face. And I just want to start with this first question. Can you start by telling us who Grantmakers in Health is and what does GIH do at its core?
Yeah, so thank you so much, Danae, again, for inviting me. Grantmakers in Health is what we call a philanthropy support organization. So we work with foundations, corporate giving programs, philanthropic consultants, and donor advisors to help the foundations and other health funders, as we say, learn, connect, and grow. So we are an educational organization. We do programming, we provide surveys and briefs and topics, we have convenings. We've been around for 40 years. So we work a lot in that time since we opened our doors 40 years ago. The field of affinity groups, as we're called, or philanthropy support organizations, has gotten a lot more crowded. So we work with a lot of the other organizations, such as Grantmakers in Aging, as well as funders together to end homelessness and those related to birth equity and reproductive justice. So there are a lot of us out here. There's overlap in the participation, but we are, as I said, focused on helping them learn, connect, and grow, learning about important issues, opportunities, initiatives, connect to their peers and others in the field and beyond, because we know that the challenges that we're trying to solve as a country are not ones that can be solved by one organization or even one sector. So partnership is critical, and then grow in philanthropic practice. And so there we talk about things that people may be familiar with: trust-based philanthropy, the engaging with community and empowering community and sharing power with community to be able to address these issues as well. So that's kind of in thinking about the general operating support and pushing some of the funders to be able to do more of that. That allows all of the folks who are on the ground doing the hard work to be able to leverage the resources and maximize those to be able to do the work that they're trying to do. So that's a little bit of us, and I'm sure we will talk a little bit more about it, but our strategic plan really does center health equity and social justice. It is something we've worked on for a long time, and obviously, as you were reading my background, something that I've been passionate about for my career. So bringing that lens and the work, but really making sure we infuse that across all of the areas that we engage in.
Thank you for sharing that. You're doing such amazing work, really building the capacity of philanthropy organizations as they're supporting work in the community. You've held leadership positions in various organizations and systems, really aiding them in the implementation of DEI practices. What's the difference between operationalizing DEI and advancing health equity?
It's a great question. I think that as we have seen more people become aware of the inequities that we have in our society over the past few years, especially with the pandemic, I think sometimes there's a little muddying of the terms. And so when I think about, DEI, diversity, equity, inclusion, or justice, equity, diversity, and inclusion, if we do JEDI, whatever, there are a lot of those terms. I think about those as kind of the who's doing the work. So when we look at ourselves organizationally and internally, are we providing those diverse perspectives so that we as an organization and an entity are coming up with, understanding and creating that space to hear the best ideas, that we create equitable environments in our own organizations to make sure that our policies don't disproportionately benefit or penalize different groups. And that inclusion of making everyone in an organization feel welcome and able to contribute to the most that they can. And that inclusion, when we think about the diversity of our beings, none of us check one box. So, visually, I'm a Black woman. And so that's one part of me. But I'm also, sort of someone who grew up maybe in the South, or, someone who may have grown up in other places, and those perspectives, or someone who may be first generation, and what that means to be able to contribute and engage the issues and things. And when we create environments where everyone feels valued, feels able to contribute, we really do get great output. And then when we think about health equity, I think about that more as the who we're serving and what we're trying to accomplish in that through our work. And so health equity, pick your definition if you want to use the World Health Organizations or Robert Wood Johnson's or the CDC, but effectively the ability for people to attain their highest level of health, and the removal of those barriers that are in the way and structural. And so to me, that kind of operationalizing DEI, how we do our work and who's doing the work, and the health equity, who we're helping and how we're working to achieve those outcomes through our work and what we're doing and engagement.
Thank you. I agree. I think sometimes those terms get muddied. But operationalizing DEI is really the practice, right? Institutionalizing it, and then health equity ends up being the outcome from that practice.
Yeah. And I think in both cases, one of the things for both DEI and health equity, it's a journey. So, our DEI, operationalizing DEI doesn't end when we hire somebody to lead that work in our organization. It doesn't end with a survey that we have of how people are feeling. It's a constant evolution and change that we have, just like health equity is a destination. It's a journey that we're on, and it's going to take us time to get there. So we have to continue to do that work and to be vigilant about doing the work and intentional about it.
So as a philanthropy support organization, how is Grantmakers in Health supporting its funding partners on the journey to advance health equity, social justice, diversity, equity, and inclusion?
So this is one that we have done a number of things. So one, we have convened some of the diversity, equity, and inclusion staff and the ones who are leading the work in philanthropy, because just like so many sectors, there have been a lot of hires in that space. And so being able to connect that peer network to be able to share lessons learned, share challenges that people are experiencing of how they are engaging in that work and where they're moving forward. We have on the health equity side, sort of surveyed our funding partners about how they have been pivoting their work as a result of the pandemic. So I am pleased to say that of the 200 plus foundations and corporate giving programs who are part of GIH, when we started this journey, when I started in 2020 with GIH, the majority of them were already doing health equity work. So this was not new to them, but they deepened that work, created new programs, like everyone, as I mentioned, hired folks to help lead that work. And so we helped to create some of those spaces. We surveyed them to see how the work was changing and what they were doing. And we're pleased to say that additional resources were going in, resources that they were reviewing their grant making processes to think about how they might have inequities unintentionally built into those grant making processes to try and address those. Evaluating how they're engaging with community and bringing that voice in to help identify where there are areas of opportunity, as well as how you may help design better solutions and not be so sometimes we can be a little paternalistic of we know what's best and this is what we're giving you the money to do, but how we have that space to allow for that. The other thing that we have been doing is we provided recommendations for how we can improve race and ethnicity data and the importance of other equity data that is needed to be able to identify and monitor our progress on addressing inequities. So that's, commentaries that we've provided, reports and analysis that we've done. And then again, infusing that throughout all of our work. So thinking about when we're engaging on the food and sustainable agriculture activities, how is equity being carried out throughout that? Or thinking about behavioral health and what are the challenges that we face when we're looking at behavioral health and the inequities there that we have. So really just so many ways, it just is part of who we are and what we're doing.
I love that. So you mentioned a few funders that you all work with that are part of GIH. How specifically are you seeing these practices of the funders shift to focus on DEI and health equity?
Yeah, so there are so many ways. So one that comes to mind, we have a funder who has been thinking about who's managing their money and how they can engage more financial managers of color in the resources, because some foundations, they have a lot of money, and that's another way some of that economic inequity, if that money is all being managed by organizations that are not very diverse. So how do you, so that's one way, and they have set a goal to be intentional about diversifying the management of their money to have that in ways in which more advisors of color are managing those resources. So that's one. We also see a lot of people looking at their boards and the boards of directors, and who's kind of providing that strategic leadership of the organization and sort of helping to guide that and trying to be intentional about diversifying their boards. And again, diversity is so many different aspects. So, making sure we don't have just, the coast represented in the diversity, but thinking about other communities as well as racial, ethnic, gender diversity, other ways as well. We've seen philanthropy step into the space a bit more on accessibility and inclusion, and thinking about, we have a President's Council that a couple of foundation leaders are doing around accessibility and inclusion, to think about how philanthropy can be more inclusive, not just of the support for programming and initiatives to help individuals with disabilities, but how philanthropy itself can be more inclusive, and how we can make sure that we, again, having that representation among our staff and the people who are doing the work, because again, those voices can make sure that we are lifting up the needs across the spectrum of our work, and all makes us better. So that's another place in which we're seeing some of that diversity coming out. We've also seen clearly a shift in funding to help support more BIPOC-led organizations, and to make sure it shouldn't be surprising to anybody. When we did an analysis, we found that in 2020, 2021, the amount of philanthropic resources going to BIPOC-led organizations was not representative of the community population. So being more intentional about that. And then we're seeing some foundations who also are thinking about how they bring in community voice, even down to the level of the grant making. So having that go into some of the decision making that's happening, that the community is helping to drive where those grant dollars are going, so that it really is that community voice that is helping to lead that work. So those are a couple of the examples that I would look up. And then, of course, one of the other spaces that we also continue to see is philanthropy engaging more in policy. And that speaks to the importance of the fact that we recognize the structural environment in which we are all operating is contributing to the negative health outcomes that we see. And if we really want to advance health and health equity, we have to change the environment. As I say, otherwise we're just tinkering at the edges. So we've seen foundations who've supported advocacy in their states to expand Medicaid. We've seen states who are also supporting advocacy for coalition building. So the recognition that community coalitions can come together and drive that work. And so that capacity building is something that we're seeing more foundations pivot to support, in recognition that for all of us, this is a long game that we're playing. These are not things that are going to be addressed in a 30, 60, 90-day plan, or that we're going to achieve equity next year or in 2025. Right. So those are some of the spaces where we're seeing philanthropy step in a little bit more.
That's really, really exciting. We have a number of coalitions in our network that are always looking for funding. So it's really exciting to hear that foundations are really starting to shift towards coalition building, because sustainability is so important to continue the work. So that's really exciting to hear.
Yeah.
GIH, what are some key characteristics? So not for GIH, but for some of the funders that you work with, what are some of those key characteristics they're looking for in potential grantees? And how has that even shifted over the last few years?
Yeah, I think One of the things I would say is that with all foundations, if you've seen one foundation, you've seen one foundation. So they vary quite significantly in what they're
Mhm.
for and in what they are able to do. So some foundations are place-based foundations by law or their creation of bylaws. They can only fund in this space. In
Mhm.
some, it's even, we can only fund these types of entities in this space.
Mhm.
So there's some limitations and challenges that philanthropy has that are just in how they get set up. So when we think about hospital closures or hospital conversions, the Attorney General in the state will set up the foundation with some of those resources, and they are saying this is what that foundation can do. They, in some cases, may even say, and the governor is going to appoint the board members in that foundation. So this is just a very long way of me saying it really varies. But I
Mhm.
think that what we have seen in the past couple of years in terms of that pivot towards equity, we are seeing more people who are interested in supporting, BIPOC-led organizations, thinking about those who may be sort of under resourced in some cases, and that capacity building to look beyond their typical funding grantees. So we are
Mhm.
people who are expanding the lens in which it's like, oh, well, we keep going back to these same folks. Who else should we include?
Right.
And I think, some of it also is bringing in that partnership, because how people are working together to support some of the activities so that it can kind of deepen that impact. Also have that authenticity of trust in the community that sometimes
Mhm.
may not be there if you're, the academic institution, but you're sort of working in that, and then that sharing. So
Mhm.
that also leads to some of the changes that we've seen in applications, where some cases the applications are becoming easier, quite honestly. So there are less demands that are being put forward on applicants to apply for the money, because we know that that is an issue for some small and under-resourced organizations. Like,
Mhm.
we don't all have, a whole grant writing department over here who that's
Right.
what they
Mhm.
do. So
Mhm.
if it is, a 2-3 person shop, then your ability to put together a 10-page with a 15-page budget and justification and all of that, and that not really realistic in some respects. So those are some changes that we have also seen in terms of what people are asking for, and on the reporting side. So we have ourselves been the beneficiaries of foundations who have said, we're going to sort of forego some of the reporting requirements, or, just send us a paragraph of what you did and how it worked.
Yeah.
And that's a real shift, because we are thinking about, from the philanthropic field, what are we asking grantees? What do we really need to be able to show that we're having work? And what is it that we, trying not to collect data for the sake of collecting data.
Mhm.
And a data nerd, I love data, it can be very helpful, but it can be very burdensome.
Thank you. Thank you for sharing that. So we are going to shift to our wonderful audience. I know you all have been listening attentively, but now it's time to engage in the conversation. So if you haven't already, please utilize the Q&A box to share any questions you have for Dr. James. We really encourage your active participation in this really important discussion, and we'll do our best to get us to as many questions as we can. So we just ended on a note talking about under-resourced organizations. Do you have any recommendations for them, for those that are seeking funds that maybe aren't tied to specific projects, but rather the sustainability and the well-being of the organization?
Yeah, so I would say one is, this is a better time to be seeking those sorts of resources than maybe 3-5 years ago. And
Mm.
say that because one of the organizations that is out there is Catch a Fire. And I don't know if people have heard about Catch a Fire, but Catch a Fire is effectively pro bono consulting for nonprofits. It is supported by quite a number of foundations who recognize that if you are under resource capacity building, you can't go out and do the lactation work and supporting the community if you don't have HR back in your office to be able
Right.
to manage the paperwork. So these sorts of things that it's helping to build some of that capacity and to support that. Where we call it kind of like staff extenders. So you can, these are short-term projects of like 4 to 6 weeks or even shorter in some cases, where you could get a brochure written, you could get somebody to review your website, you could get someone to help write a business plan for you. That this is kind of the support. Foundations are supporting that in recognition of the fact that it is challenging for small organizations to be able to do all the things and to have that capacity. And in recognition that if you burn out, then we don't have any programming that's happening on the ground and we can't be as effective as we would like to be. So a couple of foundations have helped to support that. And one such as Archstone Foundation have provided their grantees with a year-long subscription to Catch a Fire to be able to use that however they want to be able to use it or whatever their needs are. So that is some of that capacity building that we're seeing funders think about. We've had conversations with other foundations who are thinking, and these are some of the larger ones, like the Robert Wood Johnson, who are thinking about like, how do you support that capacity? Because we can't just do the program, but we don't, we don't build into the grant sometimes those dollars to say, oh, well, can we update our HR system or can we update the IT system that we're using to track this information? So there's some shifting that's happening in the field to recognize we need to do more of that. But it's a big ship we're trying to turn, so it's going to take some time. But it is, there are some places where that is happening more.
Yeah, I mean, that's great. I think especially for coalitions, infrastructure, coalitions run on the back of volunteers. And so it's really great to hear that not only are they starting to shift into looking to fund coalitions, but not just fund the program that the coalition is implementing, but that staff support so that they can run sustainably. That's great.
Yeah, we've heard of there's at least one coalition I know that they're getting more funding than the actual members of the coalition. So it's kind of a happy problem to have, but that's the support. And they're in different places. So I think that's one of the other things we took our board down to Alabama in March to do our own we're continuing our journey on our racial equity and social justice journey, and met with a coalition of folks in Alabama who are Alabama Rise, coming together around health coverage, around social justice and prison reform and those sorts of things. And they have got some philanthropic support. And then others were meeting with some other groups in other places. So there are pockets all over the country, which is great to see people coming together. And how do we support them to help them be able to push on the needs and things that we have? Because like I said, those problems are not one-year problems that we're trying to solve.
Right. How can grant seekers determine if a potential funder has a commitment to diversity, equity, and inclusion?
I think one of the ways you can obviously check their website. A lot of people are putting out those statements. They have statements on that you can see on the website. You can also look at what they're funding and what they say in some of their support. You may see under their what we fund or how we work and those sorts of things that focus on racial equity or health equity, things that are aligned with you. And that's one of the things that got to make sure it's a good fit on both sides, a good fit for you, a good fit for them, because if it's not, it's probably not going to work out too well. But that's one of the things. And then you can also look at, if you sort of just do a little scan via Google or the local news or so to see what are some of the statements they may be putting out or some of the things they're talking about. If anybody has looked, we have a newsletter that we put out. And so I write for our newsletter, pretty much every time, a little letter. And so that'll give you some of the things that I'm thinking about, as a sense of where we're kind of focused. So, for example, my last one was looking at the fact that we have states pulling out of the Youth Risk Behavior Survey, which is how we know that, 45% of high school students who identify as LGBT plus have seriously contemplated suicide. So,
Mm.
time when we have a clear mental health crisis, to have states pulling out of that is really problematic. So, but those are other ways you can see what leadership is talking about to help get a sense of where they are.
Those are great tips. How can potential grantees ensure that their proposals are aligning with a funder's commitment?
Yeah, so that's one we're definitely looking at what they have funded, looking at what they're saying and how they talk about it is important. Bless you. The other thing, thinking about, you can reach out sometimes to funders, and they may be willing to chat with you to just get a sense and get to know some of those program officers who are doing that, and what they are engaged in is another way in which you can learn a little bit more about what's happening there and what they're focused on. You can also, sometimes you can see, not always do you get the list, but sometimes you'll see what's been funded, what they funded, to get a sense of where they are as well.
Yeah, that's helpful. Some grant funding is on a reimbursement basis, requiring organizations to pay for the project up front, which can obviously be a huge barrier for small organizations. Do you have any recommendations to help organizations work around that barrier?
We were just talking about this very issue earlier this week. If it's Wednesday, that means it was Monday that we had the conversation. There are a very small number of foundations who are looking at this and thinking about that, particularly when it comes to money from the state, for example, or the federal government, that upfront piece. So I know of at least one foundation that is looking at working with their local banks to be able to give people kind of a line of credit that allows them to get it at a lower rate. Because if you, a small organization, go to the bank and ask for that line of credit, it's going to be at a higher interest rate as compared to that foundation. But to be able to leverage those dollars for exactly that upfront costs that are needed, or if you're waiting on the money because the state budget is doing whatever it's doing, but it's eventually going to come, that can be helpful. So we're hoping more people will think about that. I think also looking at some of the CDFIs and those development folks that also have some of the resources in the community could be another opportunity to engage there.
And did you say CDFIs? Can you elaborate just for those in the audience who may not know what CDFIs are?
Yeah, so they're the Community Financial Development Institute. So they think about the economic sort of well-being. They have some resources, can help do some infrastructure projects. They can help in other spaces. There is one in Philadelphia that is actually health focused. So they are looking at some of the work there, and we are seeing more people in the finance and business sector coming into this space. So, for example, the St. Louis Federal Reserve, as well as the New York Federal Reserve, have been looking at health and wealth for a little while, actually, but are doing more of that. So those CDFIs are sort of locally focused resources and can help in some cases, depending on what their focus is.
Thank you. Thank you for expanding on that a little bit. When it comes to addressing health disparities and advancing health equity, the first food field is really engaging in this process. Can you talk a little bit about why good intentions it just isn't good enough?
Yeah. Good intentions aren't good enough because good intentions don't always lead to action. And good intentions can sometimes lead to harmful action. And so I think that there are a couple of things that in one of my pieces kind of early on, I wrote about what it, we need to get serious about addressing health disparities. That we have been talking about it, and I don't want people to think that we just started talking about this in 2020. There have been people that I looked to when I was learning the field that had been at this for a long period of time. But what has been lacking are the resources and the support from leadership. And so what we need to really address health equity and achieve health equity is a focus from leadership. What leaders talk about in public and in private signals what they care about and what they're focusing on. So we need more leaders to talk about this, and in some cases to take that courageous stand. That we've had at this moment an increase in a proliferation of positions in health equity, diversity, equity, inclusion, programming, but we're also seeing some people pulling back from those commitments. And again, this takes time. So we need to commit to that long game and commit to those resources and stick it out, even as the seas and the tides change. We need to support the people who are doing this work and set them up for success. And so one of the things we often find and are starting to look at a little bit more now, even we create these positions for DEI or health equity. And it's that office over there focused on that work with one person who's got no budget, who has no real authority to make any changes. And so that's not enough. We need to make sure that people are integrated in the conversations where decisions are made, where that they have the resources to be able to do that, and that they have, the authority to be able to make these decisions. So that's another way good intentions are not good enough. And then, committing to the resources needed to collect and evaluate what's happening. And so if we don't look at the impact of our programs or look at who's affected, how do we know we're actually moving the needle in the right direction or being harmful? And then the last thing I would say is making sure that we enter this space with cultural humility. And so a lot of times we come in and we get really excited. I mean, we've all done it, get really excited when we discover something and we're off to the races. The first question we should all ask ourselves is, who else is already in this space? And what could I learn from them and partner with them and work on? And that's something that we have seen during these last few years of people who are coming into the space without asking some of those questions. That is causing us in some respects to reinvent the wheel. If we're having conversations about how do we define health equity, it's been defined. Let's pick one, move forward, but that redefining of an issue also creates confusion, because if it's this over here and it's this over there and it's that over there, we don't have common language where we had some of that. So the other thing is that there are, again, people who've been doing this for decades. What do we know about what's been tried and how are we engaging? I had a conversation a few weeks ago where some people were super excited about an issue that they were working on, and they were like, I can't believe it's never been tried before. Nobody's tried to do this. And it's like, well, I could actually tell you about my experience trying to get it done 6 years ago and what I learned from that. And that was one we kind of went, yeah, we're not generally the first people to think about things. I mean, as brilliant as we are, we're not generally the first, and just need to take a pause and ask that and engage with a little cultural humility.
I heard you say that, leadership is really plays a key role in driving this. And so I have a question around for grantees. How are grantees able to hold philanthropy organizations accountable for their DEI commitments? Do you have any recommendations around that?
That's a great question. And it's a great question because it also is challenging, because there's clearly a power dynamic here. Grantees want and need the money that philanthropy has. And there can be a challenge with saying something and running that risk. So I think again, in a couple of ways. It is okay to say. How you say it, where you say it makes a difference. We had a birth equity summit last year with a bunch of funders following the March of Dimes Mom and Baby Action Network meeting. And we had community groups there. And I never forget that one of our speakers said to a room of funders, you've been making us tap dance for a little bit of money. And the hoops that we have to jump through are just really challenging. And that was received well. I mean, there were some funders in the room. There was one who was really emotionally and apologized to the community groups for, anything that they may have done. We also had people who said, in the space of what we need to do to address mortality and morbidity for pregnant people, that we need to stop asking the community and just start doing what they tell us to. That we keep asking the same questions over and over again. So I think that there are spaces where you can say that and it is received. You need to know your audience though. So know who it is and how, that is going to be said. But I think that is something that can be, because philanthropy they care. I mean, these are, I can tell you, I pulled together the CEOs when we were in the midst of the pandemic and having leaders who were like, I'm not sure how to move forward. It's not that I don't want to, but I don't know. And we don't all know everything. So I think that sort of approaching it from the space of they are trying and there are challenges that we all have, but providing those ways in which here's how you could do it better. And there are some funding partners who are really asking those questions, and you can get surveys from them to complete. And I would say complete them, because if they're asking that, it really is your opportunity to share the feedback.
In that example that you gave, it seemed like there was some relationship between the community and the funders. Do you have any recommendations for grant seekers that are wanting to build relationship with potential funders? Any recommendations or tips?
I think some of it is in the reaching out, that there can be, and again, everybody's a little different. So there can be that outreach. I think of going to some of those connections. There can also be, you can leverage that coalition again, making that ask to just say, we'd like to come and share the information. I think sometimes when you're building that relationship, you're not coming with an ask, or that first meeting shouldn't be an ask per se, but we're here to learn, get to know you a little bit more, and then sort of work your way up, understanding and listening. I mean, they know if you're coming, you do want money, but helping to understand and build that relationship is important, because it helps you to also see, are you a good fit for them? Are they a good fit for you? Because again, you don't really want to have somebody making you jump through all sorts of hoops for like a little bit of money, or asking you to do something that doesn't align with what you're trying to do, because that's the box they're in and they're trying to put you in that box. So it is a little bit of a relationship building, but I do think, again, that coalition, that power of coalition. The other thing, invite them to come, speak or something, engage in community, because they kind of want to come share. So that's one way to get to know them a little bit more as well. And again, not having that first meeting be about an ask, but kind of putting the time in to get to know them a little bit more.
That's a great idea, to invite funders to come and speak about especially if that's something that they're interested in doing. That's a great way to start building a relationship between the funder and the community. It's great. Can you talk just a little bit about the concept of trust-based philanthropy? It's a word that we've been hearing a lot. And how does it benefit both the grant makers and the grantees in promoting DEI?
Yeah, so trust-based philanthropy gets more at the notion that the community has a lot of expertise, and that it is one of that collaboration and relationship, that there's sort of that trust you're going to use the resources appropriately, that you're not going to go off and buy that lovely little car with it, that you're going to do what needs to be done, but also, sort of knowing where that collaboration and partnership can be, to engage in some of those opportunities. The way in which it helps in that DEI is, again, that you're cultivating some of those relationships on the philanthropic side with the community, to kind of develop that, to know ahead of time. And so one of the examples I think about, with Mackenzie Scott, and she has been kind of transforming philanthropy and the way people are looking at things. They have done a lot of vetting of the organizations on the front end, to understand sort of what they do, what their focus is, and then they give the money with no strings attached. So there's very little requirements on that in that respect, and it's kind of this is for you to do what makes the most sense for you and your community and the organization that you have. So that kind of engagement, but is important to be able to have, to look at how we're doing the work. And it's a way to also sort of, it's power sharing. That's kind of what we're also doing in that space of acknowledging the community, the expertise, the wisdom, but also understanding that it allows you to be able to, grade funding. So you don't have to, I can only use this money for this program, and I can only use this money for this program, but coming together to really amplify and deepen your impact.
Does Grantmakers in Health have a directory or anything that our audience could look at to maybe even help them find potential funders in their state or their community?
So we do have if you go on our website at gih.org, you can see our funding partner directory in the top right corner, and see who's in the states. It doesn't necessarily tell you, it's not sortable by who's funding maternal and infant health, or who's funding food, but it does tell you at least who's in the varying states and where people are geographically, or if you just want to see alphabetically, you can see that as well. Thank you.
Thanks, Miriam. Thank you. I think we have time for just one more question before we wrap up. Looking forward, what do you believe are going to be the most pressing opportunities for philanthropy in promoting DEI in the years ahead? And what should grant seekers be looking out for?
That's a good one. In the years ahead, opportunities and challenges is going to be staying focused on this, and again, staying committed to that long game. We in philanthropy don't have a great reputation for sticking with things. We like so many folks tend to move to the new bright shiny object. So I think really kind of committing to this and staying there. I think the other thing for philanthropy, which I am pleased to see, is that in addition to the hiring of DEI and health equity folks, we're seeing more people who are bringing in policy people. And I think that is in recognition, again, that we know we need to get upstream to address the health issues. So if we're addressing, pick your term, the social determinants, the political determinants, the conditions of, whatever it is that we're using, we have to get upstream. Getting upstream means addressing those structures that are leading to food deserts, or leading to health professional shortage areas, which gets you into that policy space. So I think that that'd be an important piece. I am waiting for more funders to recognize that on the health side, we're going to have to engage in education. We cannot diversify our workforce or can support lots of BIPOC organizations or have our boards diversified if the college graduation rates for Black and brown kids cannot get above 27%. The math doesn't work for everyone. So we are going to have to engage in addressing the education inequities, the rising unaffordability of education for everyone, but particularly when we think about our vulnerable communities, what it means for people coming from rural areas, for accessibility, for whatever. We're not going to have, and I'm not saying this to say that our health workforce is only doctors, because it's not, but I'm just going to use as an example, the average MD is graduating with $360,000 in debt. Who's going to be a doctor at that rate? That's not sustainable, and we are going to have to address that. So I'm kind of reading and sort of encouraging more people to look at education, because I also think of the determinants and conditions of impacting our health, that is the biggest one, because it has so many implications for nutrition, housing, food, education, health, opportunity, wealth, just so many places. So I think that is one. Grantees, I think as well, we're with the field. I think looking at that partnership and collaboration, the recognition that we have had a proliferation of organizations, entities, seems like we're all starting our own organization. We've got to work more together. And so that's one way, kind of grantees can look more attractive, is how you are working together across spaces, because you can also pool those resources of your own talent, time, and impact to be able to expand your reach, and thinking about that. Philanthropy is also the one thing I will leave and then stop, interested in social impact. So how you are demonstrating the ability to have that impact is something that is important as well. So those are a couple of the things that I think about that keep me up at night on the horizon. How we can move forward.
Thank you so much, Dr. James. This was such a great conversation, and thank you just volunteering your time to talk to our stakeholders. Our team will be sharing a link to a satisfaction survey in the chat. Please do share your feedback with us. We do use it to help design future sessions. I'm actually going to invite our executive director, Nakia Sankofa, to close us out. And thank you again, Dr. James.
Thank you.
I'm going to go ahead and get Miss Sankofa connected here.
Am I here?
You're here. Hi, Nakia.
Hi. Am I on camera?
Not yet. You're not on camera yet.
Cool. While we're working that out, I really, really enjoyed the session. I think that so many things apply to our stakeholders, but it also applies to USBC. I think that this was an amazing learning opportunity, and I hope that everyone enjoyed it. I took like a million scribble notes. If you've ever been in a meeting with me, you know that my notes look a lot like chicken scratch going all over the place. But this is a big one. I feel like 5 pages of stuff. So I wanted to say thank you again for being here with us today, for Dr. James, and also for all of the participants. Thank you so much. So I wanted to tell you a little bit about what's coming up for USBC. So you've been seeing all of our emails, I'm sure, and on social media. We have our big conference and convening coming up in the June 8th, 9th, and 10th in Washington, D.C. We're going to have, this is our first in-person convening since 2019. And so we're excited to be in a room together and to celebrate together. We have a lot of things to celebrate. And so our first session on Thursday, the 8th, will actually be a pre-conference session. And it's free, but we're also taking donations for that pre-conference session. It is going to be an excellent workshop led by 2 wonderful consultants to USBC, Calandra Tibbs and Dr. Kimberly Broomfield-Massey. They'll be looking at, I think it's a really nice extension of the conversation that we've had here. They will be looking at how do you use evaluation to inform your next grant writing opportunity. So how do you use those fundamental tools about how you look at your work, how you create a logic model, and how do you begin to apply that to the work that your organization is doing. And how would you write that for your next grant? And our conference will start that evening. We're going to have a lovely opening, and I hope to see you there. I hope to see you in the space. And so we are a nonprofit organization, a 501c3, and we do a lot of amazing advocacy work at USBC. Some of the things that we're going to be celebrating are the passage of the Pump Act and PUFA in late December. We have ongoing policy initiatives. One of the main things that we are working on this year is going to be around paid family leave, but we also support numerous other initiatives. The work that we do that is in particularly associated with legislative action and lobbying, those things are not funded by our core funders, and that's where we need your help. This year, well, right now, we do this all the time, but right now we are having a special campaign in honor of all of the special mom figures in our life. It could be your mom, your grandmom, it could be your auntie, or it could be your next door neighbor who's always been a really special person to you. So we have our Mother's Day campaign. We have a really, really attainable goal. It's $2,500. I know that we can do this together. If you find that you benefit from the Weekly Wire and other resources that USBC shares, please consider joining us in making a special Mother's Day campaign. You can do it in honor of a mother or special person in your life who stood in that space. Again, thank you for being here with us. You got the link to the campaign. Again, do not forget to do your evaluation and your satisfaction survey associated with this session. We want to know how to serve you better. That's our goal. Thank you.
All right. Thank you, Nakia. And thank you again, Dr. James. We hope you have a wonderful rest of your week. We'll see you at the conference in June and then at the next webinar. Take care.